Closer look at what coronavirus numbers mean across the state of North Carolina. So Cone Health's infectious disease specialist, Dr. Cynthia Snyder, is with us today. So Dr. Snyder, in your opinion, what do those numbers look like currently?
Over the last week, it's been quite concerning. In North Carolina, we've had a daily count of over 2,000 cases, and we've had this is a increasing trend ever since at least a couple weeks ago. And I guess I worry that as the state has reopened, as people have come together for certain um, like celebrations, be it birthday celebrations, 4th of July, work barbecues. We're all placing each other at risk for acquiring coronavirus, SARS-CoV-2. And so today marks the time where for North Carolina, we've sort of greater than 100,000 cases. And as you can imagine, that as more people still don't adhere to wearing a face mask in public, those numbers will continue to increase. I think Governor Cooper was right to hold back any further expansion of reopening until we have a better control of this epidemic in our community.
So would you say that things are getting worse? Are they getting better? Are they staying the same?
So, they're definitely not getting better. They are essentially creeping up, not substantially higher, but what we do need is people to really adhere to wearing face masks in public. And that in itself, it's such a very simple intervention, can definitely make an impact for us to succeed in overcoming the spread of COVID-19 in our community. We've had increasing hospitalizations, and we'll likely start to see more deaths in the coming week, especially if older folks start acquiring the infection. Right now, we know that in the initial few months back in March, it was an older population that was being hospitalized. Now we're seeing people in their 40s and 50s also getting hospitalized. We're still seeing outbreaks in congregate living homes, and so it's still very challenging for us to say that we're definitely not out of the woods. And I think what's the most important part is that we really have to embrace wearing face masks in public so that we can make it safer for our people to go to work, right? That's the key part. And also, we want to have our rates much lower in our community so it's safe for our kids to go back to school.
And Dr. Snyder, is there anything else that community members can do? Because we've said it from the beginning, we are all in this together. We all have a part to play. But what can the community do to keep those numbers at a manageable level?
So again, I'm a big fan of the campaign of the 3 Ws, right? So often we have to think about wearing our mask, right? And that the second W would be like waiting to have at least 6 feet. So if you're going into the supermarket or if you're going to a restaurant, you have to keep an eye out to making sure there's not too many people there and ensuring that you have enough space. And then the third W is to keep vigorous like hand washing. I think in our community, the key part is often, even though there's been more mandates in different companies to wearing masks, we should definitely just start getting used to wearing it pretty much anywhere, I would say.
And when we do hear that certain numbers may be dropping lower, does that mean it's time where we can go back to a normal way of doing things, or do we still need to keep COVID-19 top of mind?
That is a great question. I don't think we're really going to be out of the woods for quite a few months, if not through the end of winter. I think the masks, they play such an important part for all respiratory viruses, not just SARS-CoV-2. So I think the masks will also help us when flu season comes around. It definitely will help with other respiratory illnesses. And so it's important to think that the reason why we're wearing a mask now is not only to protect yourself, but you're protecting your loved ones, your parents, maybe family members or neighbors that have other illnesses that place them at risk for acquiring it and having worsening outcomes. And so for the right now, I would say the masks is kind of going to be part of our regular day-to-day attire. And until we get access to maybe a vaccine later in the maybe in early 2021, and we're out of the respiratory season, that's maybe when we could consider not wearing masks. But I think it's too early to tell when we can abandon it.